Okay. Hi, I'm Dr. Joe Albano at the Albano Clinic. Today we're going to talk about knee cartilage repair without surgery. So I got my buddy here, Nicki Knee. So Nicki over here, he was skiing early season because when we're recording this now, it's early December and there are some people skiing, and I've seen lots of bad accidents happen during early season. Obstacles you just can't see. So Nicki's one of those. Nicki was skiing and this is what happened to him. It's kind of bad. So Nicki needed some surgery, but he had cartilage damage. And what can you do for the cartilage damage? Well, if you look at the lab and the animal studies, you can use stem cells from fat and bone marrow to help repair the cartilage. And think about cartilage like this. So if this is the bone, and there's cartilage overlying the top of it. Think of it like asphalt on the road. Winters around here in Salt Lake City, you tend to get a bunch of potholes, and they just get worse and worse and worse as the season goes on. So Nicki here has some potholes in his cartilage, otherwise known as osteochondral defects. And so you can use the stem cells from fat and bone marrow to help heal those things. Animal studies and lab studies show that you can do that. But why does that even hurt, and how does that cause pain? Because we know that the cartilage doesn't have any nerves in it. There is a great study, which I've quoted before, done by an orthopedic surgeon many years ago, and he's crazy in a good way. This guy, what he did was he had his orthopedic surgeon buddy scope his knee without anesthesia, and he had him touch all these different parts and see what happened. So when he touched the chondral cartilage where the potholes are, nothing happened because there's no nerves in there. It's like, I don't even feel that. Touch the meniscus, nah, nothing happens, no nerves in it. Touch the synovium, which is the sac around the whole knee, jumps up off the table because there's so many nerve endings in there. So same kind of thing with the knee and with arthritis and these potholes or osteochondral defects. There's no nerves in there, so what's causing the pain? Well, arthritis really is a bunch of these inflammatory proteins that the synovium, the sac around the knee, makes. So it makes these proteins that are bad, and they aggravate the synovium in there, and that causes a lot of pain. We see this all the time with people who come in here, one side, bone on bone knee arthritis, doesn't hurt. The other side, it's got a little bit of arthritis and it's so painful. And so that just illustrates the point that it's the synovium and not really the osteochondral area, the cartilage or the meniscus for that matter. So how do you treat those? Well, you can get surgery, you can get a microfracture where they poke holes into the bone and get it to bleed, and you can get cartilage formed on there. It's not the best type of cartilage. Usually you want a better type of cartilage, and the better type of cartilage is grown when you expose it to the stem cells. So what we like to do is we like to use your blood, your fat, your bone marrow, put it into the knee joint, sometimes into the bone if it's severe enough, and that can really help to cause decreased pain and increased function. There's a guy, Dr. Hernigo, out of Paris, who's done lots of work on this, and he has studies that back up these points. So you can do something to treat the cartilage without surgery. That's the whole point of this. So here at the Albano Clinic, we like to help you live better without surgery, and that's just one way you can do it. So thanks so much for listening.